I've had two patients this week that probably qualify as being unique, or at least down here this week. I had one patient, a 20-some-year-old boy, that had terrible infection in the palate. Usually infections go out to the buccal, out toward the cheek, but his went into the palate, and all that was left was 3 roots. And I was really concerned about post-op infection, so we loaded him up on antibiotics and gave him a bunch of pain pills after we got the tooth out. And we followed him. It was fortunate he was at the deaf school, and we were able to follow up, and he was doing well. So I haven't, and maybe we'll see him today, I don't know, but so far he's doing very well. And then I had a lady with a mucocele, which is a little growth on the inside of her lip, and we usually don't come prepared to remove things like that, but she was screened and triaged, and they came over and asked if we could do it, and so we said sure. And she was pleased to get it off because it was one of those things where she was biting her lip every time she was chewing and so forth. It was very irritating, and it had gotten very hard, and it was only going to get bigger. So I was really pleased that we were able to help her out in that respect. Those are 2 cases that are just kind of unusual that you have down here, because most of the time we're taking out just routine kind of extractions, and those were really different.
Yeah, I saw a young girl that has a giant lymphangioma was in the hip, a huge tumor extended all the way down the leg, and they had attempted surgery, and she had a continuous leak of lymph fluid through part of the scar that had never healed. And we're going to be looking into a new medicine they're trying, but unfortunately it looks like the main thing is going to be trying to keep it clean and uninfected, and I think they're also looking into a wound section to try to keep the area dry. We saw Hannah, which was a positive one. Hannah's the little girl that had a respiratory infection and had to be put on a ventilator through a trach when she was tiny, but then got a lot of scarring, and they couldn't remove the trach, and she's had one surgery which was not able to get the trach out, but she's doing much better, is beginning to learn how to talk, and then they're planning to do another surgery later.